Jiwaka Provincial Health Authority has so far recorded 434 positive cases since the start of COVID-19 in the province at the beginning of 2020 and a total of 30 deaths. 10 deaths have occurred since the surge on September 17. However, those who died at home are not recorded. JPHA CEO Thaddeus Turi confirmed that most of the deaths were from imported cases. Only 6 deaths were from local transmission. JPHA were able to manage the spread of COVID-19 cases in the province due to various reasons. Meanwhile, Kochi Provincial Hospital continues to provide clinical and public health care with a 30-bed isolation ward for seriously ill COVID patients.
We trained our officers, and that is why you can see that Kochi Hospital has a bed capacity of 30. But not one time to date, they have full bed. No. Why? Because we are preventing our people from coming to Kochi. And also we encouraging all our health workforce to do rapid diagnostic tests as soon as possible on all SARI cases or subacute respiratory infections.
Other mild cases are being isolated at the 6 isolation centers in the 3 electorates. Jiwaka's health authority has been preparing since last year to deal with the surge of COVID-19. They trained their health workers on methods to care for COVID patients, testing, ways of handling PPEs, and recently vaccinations. 96% of the workforce have been vaccinated. The only request is for the 3 local MPs to support financially and help in upgrading the isolation centers to cater for COVID-19 patients.
These funds is another problem that we have. Otherwise, if the funds are channeled to the provincial health authorities, all health authorities in the province, then I think we can manage. In other provinces also, I believe that we can manage. The number of deaths can be reduced.
Stakeholders, including the Jiwaka Provincial government, are working closely with the COVID-19 Taskforce committee to ensure funding is available and is used appropriately. Governor Dr. William Tongamp and the provincial administrator Stefan Wusik are leading by example by getting their vaccines.
We have done extremely well in the 3 different stages of COVID-19, at the awareness stage, to the preparedness stage, and then actually to the containment stage. We have done extremely well, and that's the confidence that we are giving to the people of Jiwaka, both in the province and also as well as those outside of province, but in Papua New Guinea. We are looking after your people very well.
Meanwhile, Jiwaka is also on a 2-week flexible lockdown with curfews starting at 7 p.m. and ends at 6 a.m.
For 2 weeks alone, we will concentrate on COVID-19 issues. So on-call policemen are to do with very serious matters, only deductible matters.
Schools and businesses will still open for business, but police are patrolling the province to make sure COVID-19 protocols are followed. People are also advised to adhere to the measures put in place to help minimize community transmission. Vasanatha Yama, National EMTV News, Mount Hagen.